Well, a typical day in at least my academic life doesn't really exist. I'm asked that question quite a bit by students and trainees, and I will always say, well, it really depends on what week you're getting me at. So I have weeks where I'm on clinical service. I'm a neurointensivist, so I work in the neuro ICU, and that usually means early mornings, rounding, very high acuity, multitasking, but really attending mostly to the clinical service. And then my academic things usually kind of fall by the wayside or are paused for a week or so as much as possible. And then other weeks I'm on research. I also either lead or attend professional development courses. I run a clinical research lab, I mentor, I teach students, fellows, residents. And so every week is different. Comes up a lot even when I'm making my own doctor's appointments. They always say, well, what day of the week is good for you? And I'm like, well, what week and day are we talking about? And so it gives me flexibility sometimes, sometimes a little bit less. But that's kind of the thing for me, at least, that there is no typical day. Well, as a trainee, you're kind of only exposed to academic neurology. And I was very early on interested in neurocritical care, which was a very young subspecialty and really just started when I was a resident. And so there was no option to be a neurointensivist outside of an academic center. I think that's changing these days, but I'm very happy with staying or having stayed in academic neurology. And sometimes trainees, fellows especially, they ask, well, which way should I go? And I usually advise, well, it's really up to you and what you want to do with your life. There's pros and cons certainly to everything, but it's really my subspecialty that inspired me. But I'm able to do so many different things in the academic world. My career evolved from, obviously being a trainee to then a very young attending, where I worked mostly clinical at the beginning, but I was also tasked to build the research in neurocritical care at my center. I was only the second neurointensivist at my center during my first job and was given a lot of freedom and support from my chair at the time to really build up the research. And so I was able to successfully get some career development grants. And I think my topic of research evolved the most from coming out of fellowship and seeing a lot of subarachnoid hemorrhage to then moving on to a center that didn't have that much of it, but a lot more traumatic brain injury. The funding at the time also was such that there was a lot of funding in traumatic brain injury and not so much in subarachnoid. And so my interest evolved, and I was then, based on my own observations in clinical practice, much more interested in prognostication and shared decision making, and realized that there was a real need and a huge gap in my field in that area, and surrounded myself with mentors from other fields of medicine, not neuro, that were in that and shared decision making, and then really evolved into a shared decision making researcher and prognostic communication researcher. So my career has really evolved from clinical to then more and more research, which also means less and less clinical. And then I started moving into leadership positions, both within research as well as I was also interested and had opportunities for faculty development, and was leading a faculty development program at my prior institution, which was great. It's a combination of really mentoring the junior faculty members from every department in the institution, a lot of professionalism, teaching things that you don't really learn during fellowship or in your early years of being a professor or a junior professor. And now I've recently changed institutions and my role has evolved a little bit. I still have a divisional leadership position and research, and I'm really focusing on my lab and have recently taken over National Professional Society leadership within the Neurocritical Care Society. I'm one of their officers now as of this fall. And so that will be kind of taking over a lot of my focus in the next 5 years, and I'm very excited about that. I think in academic neurology, it's very normal for careers to evolve as opportunities arise, but also as interests change. And I always say it's okay to change focus, maybe not every year. You kind of still need to have a track or a niche or something that you should be known for. But otherwise, if you're, very few people I know have stuck with just one pathway or one area of interest. So I think that's, again, an advantage of academic neurology, that as opportunities arise, you can, and go take those opportunities and grow along them. Most rewarding, at least for me, I mean, everybody might have different things that they find rewarding. For me, it's several things. It's pushing the boundaries, and that might sound very, cheesy in a way, but it's really pushing the boundaries of maybe research or the area of interest, kind of paving a path where there wasn't one before and getting that freedom. I really like interacting with other similar-minded people who are thinking outside of the box or creative and help move their own field forward. I also, again, like some flexibility of doing not just my clinical work, but researching. Mentoring is a big factor, a big chunk of time that I love doing, and kind of bringing forward students, fellows, and making sure they also understand academic neurology as they consider doing that. But as I said, not only am I teaching or mentoring or researching or treating patients, I can also do other things like leadership things or professional or faculty development programs or leading in professional societies. I find that very fulfilling as well. And so it's this kind of combination of filling my cup in whichever way I like to do it, and having the flexibility to do it, which only academic neurology can offer. So those are very common. That's a very common question by trainees. And I always say that what they see as a trainee is usually not what your faculty job must look like, which means as a trainee, you're very involved in the clinical care, which of course we all want to do and love, but a lot of the things that you have to do as a trainee might feel painful, and as an academician, you're doing many other things. So what I mean by that is, moving on from just filling the shifts and doing the little itty-gritty things to more of supervising and also, strategizing if that's something one is interested in, and that you can really build the job in a way that you want it, with some limitations, obviously, because there's also obligations that you hold towards the chair, or the division, or the institution. But over time, most academicians, I will say, can build their job as they would like to, with some limitations. So if you want to be fully clinical, there's probably room for that. If you want to do a lot of research, if you get the funding, you can do that. If you want to do a professional development or other leadership, most of the time you can also do that. You have to build the trust with your chair to be able to do that, and certainly bring value to the department and be a good team player in order to gain that flexibility. It's something that I always say you have to earn over time. But if you come in with a vision and some strategizing on how you can achieve that while you're still a team player and serving the department, I think it's a win-win for the faculty member and the department.